Today, I'm here to talk about a very common but a very interesting and an important topic of diabetic neuropathy. Diabetes, along with hypertension, is a very common non-communicable disease affecting large population worldwide. How does diabetes affect the nerve is a question that many of you would have. The commoner symptom would be a neuropathy. What is neuropathy? The nerves start from the brain, they go down to the spinal cord, and they enter the nerves of the hands and legs, and these nerves are called peripheral nerves. They're very thin, they're like spider web, and these nerves first to get affected if somebody has diabetes. So how do I pick it up? Simple symptom would be as we call pins and needles, or a burning feet syndrome, where the patient feels that something is crawling on the soles or in the hands, or they're feeling a pinprick, or they're just feeling it to be very warm and burning. These are the earliest signs of peripheral neuropathy. Many of you would be surprised to know that a peripheral neuropathy of diabetes, can precede 2 to 3 years. It's before the onset of diabetes. So this becomes a warning sign and may tell us that we are liable to develop diabetes in the future. What could be the advanced symptoms? In severe cases, they may lose muscle bulk. We see many people coming to us and tell us that they have lost the volume of their hands and legs. They feel the muscles have just, vanished. So this is a stage we call as a diabetic amyotrophy or atrophy of the muscles. Next, they may have severe pains and pins and needles, and they may have falls because of imbalance in walking. And then they realize that they're tripping and falling because of the weakness in the legs. In very severe cases, after an injury to the leg, patient suddenly realizes the leg is bleeding, but it is totally painless. The wound would be big enough, but they're not having any pain, and that's the reason they're not able to realize that they have had an injury to the leg. This is a severe diabetic neuropathy. As a neurologist, many ask, apart from peripheral neuropathy, can diabetes affect the brain or the spinal cord in any way? The answer is yes. Diabetes, if uncontrolled, can predispose one to brain attacks or strokes, just like uncontrolled diabetes can lead to heart attack or myocardial infarction. If diabetes goes unchecked, they may have a vulnerability to develop dementia much earlier than what age it should normally come, by developing multiple clots in the brain and by shrinking of the brain secondary to diabetes, as we call as cortical cerebral atrophy. They may have a severe tendency to develop bladder issues or urinary issues. They may develop constipation. They may not be able to, empty their bowel frequently or regularly. How to prevent diabetic neuropathy? Very simple. Treat diabetes at the earliest. Make sure you have a good diet. And that's the primary treatment of neuropathy. There is no specific treatment on neuropathy. We have to treat the cause of neuropathy, which invariably is controlling diabetes. So dear friends, it's very important to have an open eye and to look for any early signs of diabetes, especially in the nervous system.